I'm Cynda Rushton. I'm the Bunting Professor of Clinical Ethics at Johns Hopkins University and in the Berman Institute of Bioethics in the School of Nursing. And I am delighted today to be joined by my colleague and friend, Dr. Laurie Leitch. Laurie, would you like to introduce yourself?
Sure. And I'm really glad to do this with you. We've talked for a long time about doing something like this, so it's nice that that day is here. So I'm Laurie Leitch, and I am the founder and director of Threshold Global Works. We're an organization that does trauma and resilience consulting nationally and internationally. And so in my international work, it was when it was first highlighted to me the importance of coming up with some very practical way for people to be able to take better care of themselves and actually be able to be their better selves as they go through times of uncertainty and fear. And so that's what we do at Threshold Global Works. We work with lots of people, schools, first responder groups, medical systems, and so forth, helping people learn a set of neuroscience-based concepts and skills that help build their resilience.
Dr. Leitch has a lot of experience working with people with trauma. And it seemed as if this was a perfect time to see how we might be able to align our efforts around helping people to address the ethical challenges that they're experiencing every day in their work. And as a nurse, I'm very much aware of the kinds of challenges that clinicians are facing and the way in which they are experiencing a lot of moral distress, but also feeling a sense of tension around how they can actually be whole in the midst of all the chaos that's around them. So I'd like to start by asking Laurie to talk a little bit more specifically about the social resiliency model, its neuroscience foundation, so that you can understand the basis for the skills and tools that we'll be talking about in just a few minutes.
Okay, so I'm a really practical person. And what I realized in the years that I had a private practice in Washington, D.C., that something often seemed missing. And over time, I realized that a part of it was that so many of our interventions are based on either emotion or cognition, and it was leaving out the body. And so as I accumulated trainings and things like that, I really got excited about what we can use neuroscience research for in building people's capacity to take care of themselves. You know, the World Health Organization has a term, health literacy, and it means having the knowledge and the skills to contribute to your own good health. And even though I consider my model a form of health literacy, it's a stretch from the World Health definition, but we have a set of neuroscience-based core concepts, as well as some practical skills that people can use to help build the capacity for self-regulation in the brain-body system. And we've used it with all kinds of people, including those with very low levels of literacy, but as well as people highly educated doing the kind of work that you all are doing at Johns Hopkins with this coronavirus. So I'm excited to be able to talk to you about the neuroscience base. And so I'm just going to tell you, you know, some key pieces of it. I could talk and talk, but I won't. The central concept that this whole model is grounded in is the concept of attention. This tool that we have that for some reason that I have never understood, we don't appreciate its power, its potency. So what we know is that where you put your attention is essentially what you're wiring into your brain. Where there's a sports physiologist that says it, where your attention goes, energy flows, and that's what grows. So we know that about attention. And we also know that there's two little structures, but let's just talk about it as the amygdala in our brain that monitors our well-being all the time. It's our smoke detector. The trouble with it is that it has a negativity bias. And so if we ever have a kind of unconscious choice, our attention is going to go to some kind of novelty in our environment that we perceive as being threatening to us in some way. So knowing that, it's not surprising that in our healthcare system today, it's very easy for dedicated providers to end their day with what you've told me about the review of the day that's a pretty negative review, or to focus on the inadequacies and the ineptitudes and the fears. And as people do that, where their attention has gone is contributing to filling their bodies with toxic stress chemicals, especially after 20 to 30 minutes, which is nothing in the day of a healthcare worker. That's a piece that has been very reassuring to me to see as I work with large populations after human-caused and natural disasters, where we'll work with 200 people, all of whom have been in a state of high stress and trauma for days or weeks or even months, which is a little bit what's going on now. People can be experiencing this time as either stress, distress, or trauma. I think of it as a sort of continuum. And depending on sort of your inherent stability in your nervous system, something may stay a stressor that for another person may be traumatic. And so that's my model targets any of those along the continuum with this very practical orientation to concepts and skills that help people manage that kind of reactivity, shift their attention away from that negativity bias so that they can hold both the things that are actively going on that are negative, as well as some of the things in their same environment or in their past or future that aren't negative. Does that sort of do it for you in terms of a little orientation?
Yeah, I think that's really important. And, as we think about the impact of the coronavirus on all of us, what we're seeing in the healthcare environment is often this sense of feeling overwhelmed by the enormity of the situation that we're in. And underneath that are often feelings that we're compromising our ethical values. And so when we feel that what we're doing is maybe causing more harm than good, we worry about, in this contingency phase, that we're having to change our usual standards of care in ways that we worry might be causing harm to our patients, that we are worrying about things like how to allocate our scarce resources, including ourselves. And that creates a kind of moral residue, I think, at the end of the day. And Laurie, you were mentioning the sort of the end of the day review. And I know for myself, and I know for a lot of clinicians, that moral residue can be a really heavy weight, at the end of the day when we feel like we have just we've done our best, but we feel that there are so many things that are left undone. And we worry that, did I do anything that was beneficial today, or did I just cause more harm? And so that sort of sense of deficiency can kind of take over and leave us at the end of the day feeling even more depleted than we already are from our physical and psychological burden that we've carried that day. So I wonder, Laurie, if you could just offer a very brief example of how one of the skills in the social resiliency model might actually help a clinician who's really dealing with that moral residue at the end of the day.
Sure. One of the things that we do in this model is we orient people to what the rhythm of your brain-body system should be under good circumstances. And so, like all kinds of creatures of nature, we have these rhythms in our body, just like we have day following night or the phases of the moon and that sort of thing. And one of those important rhythms is the rhythm in the human nervous system. And when it's in a good balance. We call that in my model being in the resilient zone or the R zone. The rhythm is just a gentle wave that goes like this, and it goes on in all of us. It's going on in us right now without, below our level of consciousness. But when we get spiked out of that zone by the kind of review you're talking about, or incidents, shortages, things like that, that gentle rhythm that keeps us thinking clearly and being able to make strategic plans and creating relationships that work, we get bumped out, and that rhythm starts to look really jagged, and we either get bumped into what we call hyper arousal, which is characterized by excitability, anger, rage, anxiety, pain. Pain is another sign of hyper arousal, so headaches and things like that aren't related to the virus. Or we get bumped out below the zone into hypo arousal, which is like disengagement, dissociation, depression. And some people bounce between the two, and that's the nervous system's effort to bring itself back into balance. So what we first do is we teach people how to track what's going on inside their body, that very basic skill, tracking. It's like the hunter that's tracking the footsteps of whatever he's trying to hunt. What we're doing is we're noticing what's going on inside the body at the sensory level, because the sensation, the sensory experience is really what kind of drives our well-being and creates a climate of health or not health inside our bodies. So we start with helping people learn how to track, and we generally start by helping them track something positive. So even right now, if you bring something to mind in your life that's positive, you don't have to say it, or you can, and then you really stay with it for just a minute to let it strengthen the sense of that resource, we call it, something that brings you maybe gratitude or a sense of security or even a sense of joy. And you just let something come to mind, and then you sense into all the multisensory details of it. Now, somebody might be saying, well, I don't have time to do that when I'm in the middle of, all hell breaking loose on my unit or in the ICU. So resourcing can be done in a second, where you bring something to mind and you just sense into that. And it starts to bring your activation level back down into that resilient zone. But to know to even do it, you need to be tracking yourself. So what are you noticing before you bring up a resource? A lot of people will say, I hear a lot of people say that they carry the tension through their shoulders. And so they walk around all day with their shoulders like this, their muscles are clenched, or they feel this endless pounding of their heart in their chest, things like that. So those are the kinds of sensory tracking that we encourage people to notice, because if it goes on too long in the negative, you're filled with toxic stress chemicals that really deplete your resilience. And what we want to do is to help people shift away from the attention to that temporarily, so that they bring their system back into that resilient zone, the zone where, doesn't mean you can't be sad or mad in that zone, but it means you're sad or mad at a level that you can still keep your wits about you. You can still be engaged in what we call slow system thinking, where you can make rational decisions about things and you don't lash out at someone. You're not caught in a pattern of reactivity. And so these skills are all designed to first sensory track. All of them rely on sensory tracking what's going on and noticing whether it's something positive that's going on, or more often for people nowadays, it's not so positive because the amygdala has that negativity bias. So all the more reason why we need these very simple but quite profound tools for maintaining or restoring ourselves in that resilient zone.
So I'm just imagining, I used to have a long commute, and so I can just imagine being in the car and noticing where I'm carrying the stress of the day in my body, and paying attention to, as you say, the clenched muscles in the chest and face, jaw, wherever it is. And I'm wondering how we might help people to use that transition from work to home as a time to resource themselves, to be able to shift their attention away from the negative narrative, which was, basically I failed all day,
Yeah.
to something else. Can you just offer a suggestion about what kind of practice that might be?
I definitely can. And it's so nice to think that you can do this on your way home as an alternative to the list of what you didn't do properly. Then you go into your house and you're already depleted, and maybe you're crabby with your kids, and then you feel even worse, as a human being. So my recommendation would be, if you're doing this by car, is that you get in, or even if you're on a subway, as so many of us used to be in New York, but you get into whatever your means of transport home is. And in the first moment, you just sit and you pay attention to the support of the back of the car seat against your back and under your legs. And for a minute before you even start your car, you pay attention to the support of the floor of the car under your feet, and you just sense in, you put all of your attention down to the floor. This is a grounding skill. It's a really old, ancient skill. You sense into the support under your feet. So no thinking, your attention is completely funneled down to the floor. And as you do that, you see what you notice inside. For example, you notice what your breath is like. Does it get a little deeper? Is it shallower? Does it stay about the same? And you notice that. And then you notice the support of the back of the seat against you're contacting your back and the support it gives you. And you just sense into that. Again, this is not a process of thought. It's just a process of noticing, of paying attention. And so you do the same thing. What do you notice? What do you notice about muscle tension? You don't try to make your shoulders relax, but do they or don't they? It's not so much about it has to be this way as much as what do you notice when you pay attention at this level? And then the rest of it, you don't want to sit there all day in the parking garage or whatever. On your way home, a really useful thing to do, it's a version of resourcing, is to reflect on the day from a different point of view. So put your attentional lens on what were the things, the little moments of beauty, or the little moments of caring, or the little moments of respite, where you had a little breather, or that somebody's eyes met yours across the masks and had some kindness in those eyes. So you collect positives for yourself on your way home, and you really work at it. I mean, you don't just get a couple, just say, well, what else? So when I started my day today, was there anything positive about the way the day started? If you have kids, what was the goodbye like? What were there moments of it that felt sweet? And you just collect the positives of your day. I know it can sound like a Hallmark card or something, but it has a very profound effect on your nervous system, on your mind-body system, because you're filling your body with a positive set of chemicals, neurochemicals, that promotes health and good immune function and that sort of thing. And psychologically, it's just a nice way to go home. And so then when you go enter your house, you put your hand on that doorknob for a minute, you just sense into all the good things that also happened that day. And what lies ahead when you're greeted by whoever's there, or a pet, or the silence of a house after the hubbub of where you've been. You require your attention to go to the positives. It's not wired that way. It's going to want to focus on how much your feet hurt because you've been on them all day, or how much that little part of your nose hurts where your mask has been pushing, or the grievance that you have about somebody dropping a ball there today. But you're going to return your attention. Each time it strays, you're going to gently bring it back, like training a little puppy. You're trying to train it to the paper, it wanders away, you gently bring it back, put it back on the paper. And that's what you do with your attention. It's an attention mastery process.
So Laurie, this is, I think, really helpful information for all clinicians, and especially when clinicians are carrying a lot of a weight right now. Mm-hmm. So I really want to thank you for giving us this introduction to how we might combine some of our ethical decision-making skills, our ability to actually name and notice what the ethical problem is, and then to have some very practical skills that can support us so that we can get ourselves back into the resilient zone where we can see things clearly instead of reacting and feeling as if it's hopeless or I feel powerless or whatever the feeling is. To not push it away, but to actually turn toward it and to really take stock of how am I right now in this moment, and how can I choose in this moment to orient toward who I really am and my intention and my work, so that we don't end up intensifying the incredible burden that we're all experiencing in the midst of this COVID-19 crisis.
Well, and the only thing I would add to that is that then we're creating a climate of health in the body. It's extremely important right now, where the days are so stress-filled and there's so much uncertainty, to pay attention to shifting out of states of that kind of activation, which are reality-based. But there's usually something else that's also true. And if you can bring yourself back to what's also true, you reduce, it's like taking, I tell people, it's like taking a pair of scissors and cutting the hose that's toxifying your body with stress chemicals so that there's a different climate inside it. It's extremely important in terms of both physical and mental health.
So, Dr. Leitch and I will be doing a series applying some of these skills, and we hope you will join us in thinking of ways that we can actually support ourselves individually and collectively